podcast where we talk about women's health from a modern perspective. Today I have Dayne Alonso with me, and she is going to walk us through the journey of being the COO of FEM Women's Health. So, before we start, can you introduce yourself for a little bit?
Yeah, sure. Thank you for having me. My name is Dane, and I am a physician assistant, and I have been a PA for about 20 years. So I graduated from Nova Southeastern University, and I've been in hematology oncology for 20 years,
Wow.
20 plus years, yeah.
Oh, wow.
And so uh, I've done a lot of things in my career, a lot of things that have been a hodgepodge of things. So between clinical work, administrative work, advocacy work, I've pretty much done it all.
Really?
hmm
Okay. Um, Walk us through that. What are those 20 years for you? What have they looked like?
So I first started my career as a hemonc PA at the VA Medical Center
Oh,
down in
wow.
Miami. Yeah.
Okay.
And then I got snatched by Dr. Stephen Fine, and he was working at a large hospital system hematology practice, and so there was about 20 doctors there, and so I was the main PA in the hospital-based hematology care, and so for all that time we serviced 5 hospitals. I was doing my clinical work,
Mm-hmm.
basically working with leukemia, lymphoma, myeloma patients, and basically doing everything, hospital consults and hematology, patients. And so
Mm-hmm.
in the middle of all of that, I decided that I actually wanted to do a little bit more for the PA profession, and I wanted to get more involved with PA organizations and PA legislation. And
Okay.
so what I did, I became the president of the Florida Academy of Physician Assistants,
Oh,
and
wow.
yeah,
Okay.
and then I visited Tallahassee a lot. I changed rules and laws, for the PA profession here in the state of Florida. And so that kind of brought me to a more administrative kind of work,
Right.
in more on a volunteer basis.
Okay.
Um, then about 10 years ago, I also became the PA on the PA Council, which is the PA who basically the chair of the Council of the Board of Medicine. And this kind of opened doors and kind of made me realize that there was just so much more work that had to be done. And
Okay.
so I'm currently a member. I'm not the chair anymore, but I'm a member, and I'm still there, kind of getting PA's voice heard basically in the state.
Amazing.
Yeah. And then it wasn't until about 2011, 2012, where then I became a little bit more interested in academia. And so
Oh,
I was the director of the Miami-Dade PA program here in Miami.
oh
And so
wow.
I did a little bit of academia there. Um, then I was kind of snatched back into more of a clinical administrative role as the director of nurse practitioners and PAs at the Miami Cancer Institute. It was called Director of Advanced Practice Providers,
Oh,
and
wow.
there I was able to grow a team of about 150 nurse practitioners and PAs,
Wow.
basically placing them in all different specialties
Hmm.
between surgical oncology, radiation oncology, medical oncology, survivorship. And so basically, I had a team of over 150 nurse practitioners and PAs where I managed, credentialed, and I basically took care of the operations on a day-to-day basis.
My goodness. And
Yeah.
then?
And then about 5 years ago, Dr. Fine came to me, and we've been working together for such a long time.
Hmm.
When I became the director of NPs and PAs, I helped grow the team that he was managing. So
Hmm.
he managed the inpatient consult team for this practice, and so I kind of gave him some more help, and we're always in contact. We never
Lost
we never
contact.
lost contact. And so finally, about actually more about 7 years ago, he said, "Oh, I think we need to do masters in business administration at the University of Miami and
Together?
together." And
Oh my God.
I said, "What do you mean? And what do you want to do?" And he's like, "Well, I already signed you up, so
Oh,
you
okay.
you start on next week." And I said, "Oh, okay." So then We did our MBA together, and the last assignment for the master's in business is basically to create a business.
Oh,
And so at the end of that master's degree, we created basically what we called Heme on Call. And
okay.
Heme on Call was a telemedicine practice, basically providing access to care to hematology patients where there was no care, right? And
Okay.
so we decided to do it via telemedicine to
So you
increase
decided
that
to do it in
access.
real life and not just as an assignment.
Well, right, right. It was our assignment, and then it turned
Okay.
out later to to be a real life business. And so
Oh,
after
wow.
we're done with the MBA, it just so happened to be COVID. And so
Mm,
now COVID hit, and we said, "Oh, I think this might be a perfect time for
for something like
telemedicine."
that. Yeah.
Yeah, and this is how we started the business. He obviously left this practice that we were in,
Hmm.
started the business, and then I followed shortly thereafter to
Okay.
join him and become the COO of FEM. Well, used to be Heme on Call, and now it's FEM Women's Health.
Oh, really? Okay. That
So I
is
don't know if that's all what you wanted to know.
that that is that is very extensive.
Hmm.
So when you guys started, I mean, first of all, that's a lot to go through. Not go through, but that's a lot of responsibility. You seem to have a lot of responsibility in whatever field you put yourself in. Like you just kind of fall into the role where it's like a really you're the important person because even in a company, a COO without a COO, there's no operations that can go by. So
Yeah, kind of.
yeah, yeah. So when it came to heme on call, what was the first step? Like, did you guys how did that come to be, and what was your role when it came to that at the beginning?
Well, so he got things started a little bit before I joined him. Try to get some of the pieces of the puzzle together. But the first thing was to get on health plans. Just to make sure our patients had the availability where we would take all insurances. And so that was a big undertaking. So the first 6 months was basically trying to get on health plans.
And you
Trying
you supervised all of that? You oversaw that?
Yeah, like once I joined him, he was already kind of in the works for a couple of them, but then I kind of finished it off. And finally, I would say 6 months later, we were pretty much on all the health plans. And
Okay.
that was the first step because that's the first step of a practice, right? And
Right.
then there was hiring of personnel and
Right.
trying to get everything up and running when it came to just from, the phone calls to
Yeah.
making appointments
The
to
the small
all
stuff.
of those things.
Right.
So so that's how we first started, and then as time went on, then we grew our different departments, and obviously we hired more of
Right.
a clinical team, then we hired more of a marketing team, then we just are just growing
Growing
by
and
leaps and
growing.
bounds,
Right.
and where we are today. So
So when you guys finally expanded, when did you guys decide it was time to open up the infusion center? Like what was the because one thing is running a practice and another thing is a whole center that gives the medication that you're prescribing, right? So how did that come to be?
right, right. So our thought the entire time was that we were just going to have a telemedicine practice where we would then send our patients to community infusion centers
Hmm.
to actually receive the medication, whether it be iron or any other hematology based medications. But really quickly, we figured out that we couldn't do it that way
Why not?
because the issue was that there were infusion centers that maybe took a long time to see our patients. Sometimes our patients really need rapid care, which means there's a pregnant woman who really needs
Get this
to
iron.
have their medication quickly because let's say they're 32 weeks or 35 weeks pregnant, they don't have time to wait. And
Hmm.
so we found that some infusion centers in the area, just because of their sheer volume or just because of their systems and their processes, it took too long. It was 3 weeks, 4 weeks before our patients
Wow.
actually got the medication right. So we decided that we needed to do it in house.
Okay.
And as hematologists and oncologists, we basically have lived in the infusion world for all of our lives.
Hmm.
So we never ran an infusion center ourselves. We uh,
Had seen it.
we saw it. We
Yeah.
sent patients there. I supervised nurse practitioners and PAs that worked in the infusion center, so it wasn't foreign to me, but I had never done it.
Right.
So trying to find locations, trying to build the infusion center from the ground up, on the clinical side with protocols and
Right.
everything that has to happen in there was extremely challenging for us, but we had a lot of help and a lot of support, and we reached out to our friends and partners, and we got it done, and now we went from one to four infusion centers.
That's amazing. And all
Mhm.
South Florida, right?
All Florida, yes, Miami, Broward, St. Pete, and Tampa. So like the West Coast and East Coast.
That's amazing. And
Hmm.
I know one of the biggest distinguishing features of the FEM infusion centers is that you guys have emergency medication on board and that you have a very skilled infusion staff. So what was how did that come up? How did you make sure that that was taken care of for the patient?
Yeah. So one of the things that I learned throughout my career was the skill set that I needed for these infusion centers.
Mhm.
And so iron, which is the main medication that we deliver at this infusion center, could come with some side effects and some reactions. And so what I wanted to do was hire highly skilled nursing team that knew how to take care of these reactions or side effects that may occur, right?
Right.
With any medication you put in your body, anything can happen. So we wanted
Yeah.
to make sure. So we have a combination of nurses that we trained in house to also nurses that have oncology training.
Mhm.
So together, we put together a team that is quick, is reliable, and can take care of any single emergency. We also hired an infusion director who was a nurse practitioner and a nurse to run the infusion centers.
That's amazing.
Hmm.
So obviously now you guys do way more than iron infusions and
Hmm.
Fem Women's Health is becoming this whole hub for women's wellness all around. So what other services can people go to the center in-house for, I guess?
So quickly, we learned that our patients actually really wanted vitamin infusions, and
Okay.
so we designed vitamin infusion packages where we, have an offering of all different types of vitamins. A lot of our patients who are iron deficient, they lose their hair and they
Right.
have issues with their nails. So we have vitamin infusions tailored to hair and nails and things like
Mm-hmm.
that. So all of this was really driven by our patients.
Oh,
We
okay.
were just going to focus on medications, iron, and hematology based medications, but they wanted, because they felt that our infusion centers was a safe space. they
Mm-hmm.
they they loved our the way they felt when they came to our infusion center. We're a family, our staff is very welcoming, and so they wanted to come back to receive other services in our centers.
Okay. And
Hmm.
you guys have weight loss as well?
Oh yes,
Yes.
yes, yes. We have vitamins, we have our weight loss medications, and then we also have other, now with the onset of survivorship, we'll have other
Amazing.
medications that we'll give at our center.
Okay. And when it comes to the weight loss, I do know that you oversee that service line when it
Hmm.
comes to FEM. So can you tell us a little bit about how that came to be, why you advocated so hard for something? Because I mean, hematology and weight loss, I mean, they kind of are similar. They go hand in hand sometimes, but not really. So
Hmm.
what so what brought that to upon
Yeah, yeah. So I get so what happened was that all throughout, before I came to Hemoncal or FEM, um, I myself had been on a weight loss journey for a long time. Um, I kind of have this, like I think all women do, where under high stress levels we tend to maybe put on weight,
right?
and also, personally I was like early menopause, and so
Mhm.
that also contributed to my weight gain. And so I had a very astute doctor who turned me into this new kind of weight loss medication
Expert.
alternative. Yeah. And so which I didn't know about, right? And so I tried it for about 2 years, and it changed my life. And so what I wanted to do was bring that same program to FEM, so that I could help more women.
Yeah. And do you mind telling us a little more about what that looked for you, what that looked like for you and how you feel now compared to before?
Oh yeah, I mean, it made a drastic change. I mean, I went from going to Disney World in a wheelchair to not being able to really walk long distances to having knee pain to getting out of bed and kind of feeling that I was getting up there in age.
Oh,
I had to have arthroscopic surgery on my knee just because there was too much, weight on my knee. I went from basically not being able to buckle myself in an airplane, which I think that was kind of like um the tipping point for me.
right.
Like I was like I love to travel and I need to be able to do this.
Right, right,
From not being able to cross my legs, all of those things that we deal with when we're overweight. And so
right.
I decided that that was a tipping point for me, that I was going to get some help, and different help than what I have done all of my life,
Yeah,
between keto and Weight Watchers and all these other diets
right.
that for me weren't real successful. um, I was tuned into the GLP-1 medications, and that was way before they became the craze.
Mm-hmm.
And so I was tuned into that. I was actually I was prescribed. It was prescribed by a weight loss management doctor, and
Right,
I was extremely successful. I lost over 90 pounds, and I couldn't feel better. Like now, I'm able to do all of those things. I'm able to take my nephews to Disney World. I'm able to do things that I wasn't able to do before, climb hills and go down the stairs and do all these
right.
things that we take for granted, but when you're overweight, it really matters.
Wow.
And so I decided that because we want to be a women's health hub, and that's what we're striving to be. We want to be a one-stop shop for all women that want to have anything accomplished. And so
Right,
between giving them their energy back by getting iron,
right.
or getting their hair and nails
Their
improved
confidence
by
back. Yeah.
vitamins, and and if they were pregnant and they want to lose their pregnancy weight after, now
Right.
we have a weight loss program. And so I wanted to be a one-stop shop for women, and this is what we've tried to do by bringing in the weight loss program.
Wow. That's very impactful, and I think that that's very important to address, especially when you work at such high levels and you're under so much stress and you have so many responsibilities and you have so much paperwork and you get home and all you want to do is sleep. I feel like a lot of women probably struggle with that, especially because there's so many opportunities now for women to be in leadership and executive roles. Um, Sometimes women do it better anyways. But I do feel like sometimes, they forget to take care of themselves. And I think that that's such a big deal to bring up when it comes to that.
Oh, believe me, that actually happened to me, for real. I forgot, right? I was so entrenched in my work, and
Mhm.
in all these years trying to really make things successful, whatever I was in, you heard all of the different
The 800 things.
everything that I've done. And so in all of those, I gave my all. I gave my 150%. And by doing that, I kind of forgot about myself. I
Right,
forgot how I needed to exercise, and how I needed to eat right, and how I needed to really focus and save some time for myself versus giving my time to everybody else. And so as women, we often forget that.
right.
We forget that we're human, and that we definitely need time to focus on ourselves, and get ourselves healthy. And
Yeah,
that's what I forgot.
right.
And yes, I'm a culprit of it.
Well, I guess I mean every bad period in life has a good side, right? Because
Hmm.
if you wouldn't have gone through, forgetting about yourself, and if you wouldn't have met this doctor, maybe you would have never even thought about bringing in weight loss to something that was already growing into something bigger. You had the centers, you had the vitamins. It makes sense that weight loss would be next step, and so it's interesting that that's how it all came to be.
Yes, and definitely. And now we've hired an obesity specialist,
Right.
right, as part of our practice. And so we've hired Dr. Stacy Hennigsman, and she does our weight loss consultations.
Hmm.
I also do weight loss consultations. So it's a doctor-led program, and
Right.
that's what I experienced myself, and that's what I wanted to bring to other women. I wanted
Yeah.
to make sure that they were supervised and that this wasn't something just done,
Right. That's what I was gonna ask, right?
yeah.
Because you hear weight loss, and I mean, not to name anything, but you can go to where you get your eyebrows done and now they offer you semaglutide, right? So it's what is the difference between the program that you crafted and is it based off your experience? I was
Mm.
going to ask that. Is it based off the same type of experience that you had, or did you want to optimize it? Like, how did that come to be?
Yeah, so the physician that I visited was again a telemedicine practice,
Right.
and then he was able to counsel me and advise me, and then he was able to order the medication, and so that worked well for me as a working woman, as somebody who doesn't have time to drive and go to the doctor and do all of these things. That worked great for me, so I kind
Mm-hmm.
of wanted to bring that to our FEM centers and definitely be able to have that option for patients.
Right.
But at the same time, I know that patients also like that personal attention, and sometimes telemedicine is not for everyone. And so
Hmm.
I do have an in-person clinic that I do
Oh,
myself, and definitely talk about nutrition and exercise and laboratory examination, so that we have the whole picture before we even start. Right. So
hmm,
we'll do laboratory testing. We'll talk about their what are their current habits, and how are they willing to change those habits in order to be successful. So we do a full evaluation, and then every month we follow the patient, and we have weigh-ins every month, and we
right.
you know we talk about what their successes were, and basically have that support system that some places maybe don't offer. But I wanted to make sure that anything that occurs to the patients while they're on these weight loss medications, that we know about, that we stay connected with, and that it is a basically that they feel that they're part of the team too. You
Right.
know, that's
Yeah,
that's
part of the
basically,
family.
yeah.
Yeah. That makes sense. And then so when it comes to Fem Women's Health and the centers and everything, where do you see it heading? Like what do you think is the next big thing? I know you mentioned survivorship. What do you think is coming next?
Yeah, so we're thinking about what women need, right? We're
Right.
thinking about what women need at every stage of their life,
Mm-hmm.
because a woman goes through it's almost like a metamorphosis, right, in their life. And
I love
so
that.
as teenagers, they are definitely growing. Their demand for iron
Right.
increases. They're playing sports, they're going to school, and so iron deficiency is very prevalent in the teenage population. And
Right.
so we're there with fem hematology and our iron
Right.
infusion centers. And then as women mature, then they have other issues like heavy menstrual bleeding, like hormonal imbalances when they get into that perimenopausal period.
Right.
Right, we're there with our again with our hematology consults, and
Weight
with our
loss.
vitamin infusions and our weight loss, right? And then when they get into menopause, right?
Right.
We also now have the same type of program. But then some women obviously have illnesses that impact their life, such as
Right.
cancer, breast cancer, ovarian cancer, and we also thought we could be a safe space for those women to be able to get care and not be alone during the time post during their treatment, and really after their treatment, where they have such life effects that really impact their entire life. And so
Right.
we could really be the person and the people that take care of you as a teenager, and then all throughout the span of your life.
Yeah.
So that's kind of what we wanted to be, and that's kind of where we're headed.
You want to make it like a home for women to be
Yeah, and
taken
and
care of.
and one other thing that has occurred is that patients have referred their family members and referred
Oh,
their
yeah. So it's like a
yeah,
family
so their mom
practice.
comes and brings the child, and then the grandmother comes and
Right, brings the niece.
brings
Yeah, yeah.
the granddaughter and the mom, and so everyone basically it becomes a family affair.
That's sweet.
That's basically it.
That's very nice. Well, I am very excited to see what's next. And if you were to be able to say one thing to the women out there that they should know, whether it's about weight loss, whether it's about hematology, whether it's about being an executive and being a woman and having so much responsibility, if you could just say one thing, what would it be?
So basically, one major thing is just remember to take care of yourself. Remember that we all, as women, have multiple responsibilities. We have our home, our children, our families, we have our job, we have so many things that require our attention. And the one thing I can say is take care of yourself. Don't let yourself go, and pay attention to the signs that potentially are making you unproductive. That's what I didn't do. And now I always pay attention and definitely tell women out there that here at FEM, we're here to help in every way possible.
Thank you.